So, good morning, sir. So, good morning, everyone. My name is Jan Orillaneda. I am from BS in 11HM. I am group 31. So, I will going to perform assessing the 12 cranial nerves assessment. So, first is I will going to review the medical record of reviews medical record of the patient and the doctor's order if sheet available. So, I will going to review the medical record of the patient. And he's the medical record of the patient. So the medical record of the patient is also normal. No any consultation about the past history of the patient. So after that is, I will going to determine the scope assessment, prepare needed equipment. So I will going to prefer my all equipments for our, or I gonna use for our assessment. So I have here all my equipment. Okay. So after that, I will going to perform hand hygiene to ensure the safety of our procedure. So after that is, I will going to introduce my name and verify the client identity of the patient. So sir, good morning. My name is Jan Orillaneda. So I am your nurse for today. So can you please introduce your name?
My name is Rene Labuan.
And how old are you, sir?
I'm 21.
So can you please see your wristband, sir? Okay. So you're Uban. And what do you want to call you this assessment, sir?
Just call me sir.
So, sir, after that, I will going to explain the procedure to the client. So, sir, I will going to explain you for our assessment for today. So, I will going to assess you the 12 cranial nerves. And I need your cooperation, right, confidentially for this assessment. Then, I will going to guide you for this assessment. So, after that is, I will going to ensure the privacy and comfortable and the confidentiality of the patient. So, sir, can you please stand, sit down properly for your comfortable for this assessment? Okay, thank you, sir. So, after that is, I will going to proceed for our assessment. First is the optic nerve. Ask to the patient to close or clock the one eye or close the one eye, and after that I gonna smell the thing that I gonna use to smell, and such as copy or bar of soap, or let the patient describe the smell. So sir, I'll gonna use the thing to smell you about what or identify the things. So close your eyes, sir. So what is this, sir?
Smells good like perfume.
Okay, very good. That's good. This is an perfume. So after that is, I gonna put something in front of your nose and have you breathe in and smell. Tell me what you smell, and whatever you do, this is you something that pleasant. If the person has a sensitive nose, then after that, I assess the patient to smell the perfume and the close of his eye. So after that, I will going to proceed. The next part of the cranial is the optic nerve. The optic nerve is to check for visual acuity, use an eye-held hand and card, and ask the patient to cover one eye and read aloud the print. So that intact to test cranial nerve, you're going to be doing two tests. Number one, you're going to look at the confrontation visual field, sir. And you're going to be look at their peripheral vision. The next, you'll using the swelling. So, sir, can you please stand? Okay. So, sir, we're going to confrontation vision and the also visual acuity vision. So, I will going to use my arm hand to lead away from you. Then, so sir, can you please cover your right eye using your hand? Okay. So, I will going to same thing, the opposite. Okay. So, I will going to use my hand to identify the patient, the number in the lower and the upper and the middle. So, sir, can you please identify this?
2.
How about this?
1.
This?
3.
So, thank you, sir. the right side of the patient is also normal. No any consultation about his eye. And the next is the left side. Cover your left side using your hand, sir. Okay, then I will going to do the same thing, the opposite of the patient. Okay, so sir, I will going the same thing. So what is this, sir?
2,
How about this, sir?
3,
And this?
4,
So, okay, thank you, sir. So after that, I will going to the next part of the assessment is also to take a look, sir, the swelling site over there, 20 feet around you. So, sir, are you wearing the glasses?
no.
So, sir, can you please read what ano yung makita or mabasa dito, sir, na pinakalazo or pinakaapiki na kaya ni mo mabasa, sir?
2020.
Sir, can you please read?
Can I cover my...
Oh, cover your left eye first using your hand. Okay?
PAFFOTEC.
So the patient is also 20/20 vision. It's normal. And the second, sir, your right side. Cover your hands.
PEFFOTEC.
Okay, the patient is 20/20 vision. So the patient is also normal. If the patient, if P is 20/100, and TOZ is also 20/70. LPED is also 20/50. PEC if D is also 20/40, and EDFCGF is 20/30, and FELOPZED is 20/25. Sir, can you please read the swelling chart and both sides? Okay, the 20/20 vision.
PAFFOTEC.
So, the patient is also normal. So, I will going to the next part of this assessment is also the 3, 4, and 6. And the 3 is oculomotor, the 4 is trunchial, and the 6 is abducent. So, I will going to check the upper eyelid while the patient is looking directly at you. Then, eyelid obscured the vision. So, pupil equal size. Okay, so sir, I will going to use the pen light. So sir, can you please take a look the pen light where I will going this using your pupil eye. So, after that, sir, I will going to take a look in the head of your eye. So, sir, take a look here. Then, I will going to use the pen light using your pupil. Then, after that, sir, I will going to use the pen light in your nose to move in your nose. So after that is I will going to use my hands to same thing. So okay, the patient is also normal, no any consultation or no any, and the size of pupil is also normal. So after that, I will going to the cranial 5 is also trigeminal, and the ophthalmic and division should test symmetrical pain, light, touch, tempered, and stand. I will going to. So sir, open your eye. Hi. So after that is I will go into the cranial 5 trigeminal and ophthalmic and division should test symmetrical pain and light touch temper. So sir, I gonna touch your face or massage. Okay, the patient is also normal, no lesions. And after that, I will go into the sun pressure. facial nerves. Is in front of the patient. Ask to smile, brown shoe teeth, palm check out pursed lips, raise eyebrows, and close your eyes. So, sir, can you please close your eyes? Blink. And smile. And so, the patients also do the same thing. And after that is, I will going to vestibular to assess, or that is number 8. Test one earring at a time and occlude one of the patient ears with fingers. Stand 1/2 feet above in the patient. So, sir, I will going to say anything in the 1/2 feet. So, can you please identify what I'm going to speak? Okay.
Cut.
Okay, good. And the other side?
Dog.
Okay. The hearing of the patient is also normal, and she also easy to identify where I'm talking about. So after that is, I will go into the 9 part of the assessment. Number 9 is also glossopagoreal. So sir, can you please say and assess the patient voice? It hoarse. Does it have anal quality? Observe the soft palate and uvula. So, sir, I'm gonna put the things in your mouth. So, can you please see before that? See Okay. The patient is also see It's also normal. And after that, then can you please, sir? I'm going to the next part. Is number 10 is Bacchus. So, sir, can you please horse?
Horse.
Okay. The patient speak is also normal. So after that, I will go into the next part. Is also the number 11 is also spinal accessory assessment. So I will going to open the patient gown to visual the upper trips and muscle. So sir, I will going to touch your face. Then down. So cut, please. So okay. The patient is also normal. So after that is, I will go into the last part is also the hypoglossal open. Open mouth and assess for tongue and troponin and transviculation. So sir, can you please left, right, and up, down. So that's all B. So can you please inform the patient that the assessment is done. So sir, the assessment is done. Thank you for your cooperation and confidentiality to do this, our assessment. So after that, I will going to document all all findings of the patient. Is also normal. So after that, I will gonna to perform hand hygiene. Ensure safety. So thank you, sir.